in Africa is at a turning point. Every year, more than 150 million Africans are pushed into poverty because of out-of-pocket health payments. With public debt rising, climate shocks intensifying, and Africa's population projected to reach 2.5 billion by 2050, with over 60% under 25, the current health financing model is unsustainable. In 2022, the continent spent approximately $145 billion on health. Yet African governments financed less than 41% of that total. Households carried 37% and donors filled much of the rest. Health financing must move from fragmented, donor-dependent systems to domestically anchored, fiscally embedded, innovation-driven strategies. This is the ambition behind transforming health financing in Africa and an initiative led by the United Nations Economic Commission for Africa. The goal is clear: to catalyze sustainable, equitable, and resilient health financing systems by unlocking domestic fiscal space, innovating financial instruments, and institutionalizing data-driven governance.
How should the health sector be financed in a sustainable way? I know that some countries have done some bit of innovation where some of the infrastructure on health are taken by the ministry in charge of infrastructure, the technology is taken by another ministry, and so forth, and then they focus on the science part of it, and also the treatment part of it. Others have brought in also the private sector to be the co-investors in the health sector. But now we are saying, is this enough? What should be the innovative financing mechanism?
Health has really impact on various sectors. It's not only a sectoral issue, because if you don't have health placed in a country in a way that can help the country to address different issues, we will fail on something, because health will build economic resilience. Health will build on technology. Health will help us build on trade. So this is why ECA is looking at the health, because we are not looking at health just to address the health issues, because we know how health issues can have an impact on the economic development. This is why we think that Africa must look at it from the investment perspective and stop looking at it from the social expenditure perspective.
Health is actually an economic growth issue. And anytime you're talking about economic growth, there is always the agenda for the macro agenda now. So where do we get growth? We normally get growth by what we invest in our people, what we invest in our capital, and if those people and that capital is productive, then you even get extra growth. So there is actually a strong link between health and economic growth at the macro level.
Health is often perceived as a cost center, incurring expenses but not yielding direct revenue. However, evidence shows that every dollar invested in health yields up to $4 in economic returns. Strong health systems in Africa will mean a more productive workforce and added stability during pandemics and even climate shocks. Yet in 13 African countries, households spend more in health than governments do. In 17 other African countries, donor funding accounts for over 30% of health expenditure. This architecture exposes African states to volatility, undermines long-term planning, and perpetuates inequity. The health financing transformation spearheaded by ECA begins by strengthening fiscal foundations in the continent and crucially linking health to economic planning frameworks.
In most of the African countries, governments are paying only 41% of the health expenditures. This is not enough. And the 60% remaining are paid by population health out-of-pocket money or by international partners. And this is not sustainable. So this is where we said, let's find a way that working with all the partners together to address this specific issue. And we know at the same time that governments are facing a high fiscal pressure because of debt, because of climate shocks, because of trade shocks.
Most of the health financing, what was found out was that it was actually the bills were being made by the aid by the external donors that are coming in. And when you did it, some of the countries, goes up to 50% of the whole health financing comes from outside. Now, we've seen a challenge last year when aid was stopped. When United States, stopped their aid by 83%. United States was 40% of the total aid that was coming globally. But then at the end of the day, also the others also started reducing their aid. It started with Germany, it went to UK, it went to France, Belgium, to the Netherlands. And then you find, okay, how is the health going to be financed? Because this came abruptly and the countries were not prepared.
These donors withdrew their funding, and they tend to also have a huge component of this financing. Then there is that problem that you're not able to sustain the services that you are providing in the health sector, paying doctors, paying nurses, paying community health workers, being able to buy vaccines. And so the importance of why it's good for Africa to finance its own health is because it creates the resilience, and you remove the uncertainty because you have already embedded the financing needs within your own domestic budget. And this is what this initiative is about.
Transforming health financing in Africa is about building investment-grade and nationally owned strategies, connecting fiscal diagnostics to real reform, and protecting women and youth from catastrophic health spending. It is also about turning health systems into engines of resilience and inclusive growth. Ultimately, ECA envisions a paradigm shift where Africa's health sector transforms into increased health sovereignty and productivity for all its citizens.
I think we can say that we have succeeded when we see Africa in the next 5 years where all the health expenditures are paid by the government. That's one thing. People should not be paying for health and increasing their level of poverty. That's one thing. If we achieve that, that's okay. We should be in a situation where health is really led by technology, because the world is moving fast. And if we don't incorporate technology in the health, we'll be losing an opportunity.
So basically, we are a think tank. So essentially what we'll be doing a lot of macro fiscal analysis, understanding how these countries are, being able to say, okay, in this particular country, this is how they are financing their health. Some of the countries will be able to see maybe they are doing much better in terms of than the others in terms of the out-of-pocket expenditures. Maybe they are minimal, and so we will also have this peer learning. So ECA will not only be doing the think tanking through research, we will also be convening like we are doing here in Tangier, and we'll also be able to leverage the knowledge that is going to come out of all this to be able to crowd in or to attract other partners that can work with us in creating a sustainable health system.